Oh, Stephen Colen. Okay, come on in, Stephen. All right, here are your two patients. Here we go. Okay, first of all, doctor, where are you affiliated?
I work primarily at New York University Hospital in New York.
Okay, now introduce your patients.
This is Carolyn Tremata and Teresa White.
Okay, what did they have done?
Well, Carolyn had her nose done roughly 2 months ago, and basically the important thing in Carolyn was to put the width of her nose in proportion to her face. The primary work was done on the alar bases.
That's a lot of nose that came off.
Yeah, well, I think primarily Carolyn's problem was proportion, as most patients are. I think putting the nose back in proportion to the face is the key to achieving a good result.
How has it changed you?
I feel great. I've gotten more confidence, and I look better.
Are you married?
No.
Does it make a difference in your dating life?
Not really. Not too much.
Much did it cost you?
$3,500.
And you're totally pleased with the outcome?
Dr. Colen did a very good job.
Any risk?
I think the risk is really not in spending time with the patient beforehand to find out what they want done. As a plastic surgeon, we can do lots of things, but the key is to do what the patient wants.
Do they have like sort of Kmart plastic surgeons now? You just walk in and they just chop it off and see you later?
I doubt very much if too many people are doing things that way, and especially in New York.
So noses aren't a problem then?
I think it's really finding out from the patient what they want done and the reasons they want it done for.
Now, what we have here?
Teresa was concerned because when she smiled, the tip of her nose came down significantly. I think we can see that in the preoperative photograph. And really, in Teresa, and the important thing was in dividing some of the muscles that depress the nose. Every time she smiled and tightened her upper lip, her tip would come down because those muscles would pull it down. And it was really a matter of putting things in proportion. These were both minimal rhinoplasties that just reestablished proportion in the face.
Oh, so has it made you different, changed you?
Not really, because it wasn't a big change. It was done very slightly.
If it was so slight, then why did you have it done?
Well, slightly to the fact that it wasn't a very big change to the look of my face. It was a significant change, but not a dramatic change. In other words, when I walked down the street and I saw my friends, they didn't notice, which was something I was pleased with. I did notice, though, myself. I felt great.
How much?
35.
35. Money well spent?
Ronaldo?
I believe so.
Jean?
Ronaldo? Now, say this lady, I can't see you or what is happening there. I can only hear. Now, say, for instance, that this woman wanted a definite type nose, made her mind up, that's what I want, walks into the surgeon's office and says, this nose I want. Would that same surgeon you're talking to now, would he do that for her?
Would you?
Well, I think that the limitations are based upon the thickness of the skin and the architecture of the cartilage, and I think that if a patient's requests are reasonable, based upon their anatomy, I would certainly do everything I could to achieve what the patient wanted.
Did you custom order your nose, Phyllis?
Well, you know, you mentioned about her nose overhang. When I smiled, I lost all my upper lip. I had no upper lip. The nose came down and made a shadow on the teeth, and I got all the witch rolls. Honest to God, it looked like the two front teeth were missing, and I did that terrible thing. When I woke up and had an upper lip, oh, praise the Lord.
Praise the Lord, okay.